Good afternoon. My name is Tammy Russell, and I am a full-time student in the Doctorate of Nursing program at Franklin University. I'm currently a certified family nurse practitioner where I treat members in the geriatric population. My quality improvement project will focus on opioid use disorder in pregnant women to decrease hospitalization of the neonates and the moms through the use of the medication assistance therapy, that is the MAT program. Basically, the opioid screening tool can be implemented in primary care early on. We want to get these moms early so that they can get the treatment preferably started in the first trimester. So, just like you have your depression screening tools, we want to have this opioid drug screening tool to detect to see if young moms are using recreational drugs, opioids, heroin, whatever it might be, and they need to know that there is assistance, there is medication to help them cope and to deal with that addiction. Also, we need to educate healthcare professionals, RNs, STNAs, other nurse practitioners, doctors, whoever, and let them, tend not to be biased. Don't judge these young moms. I mean, we need to have healthcare professionals let them be educated and understand the purpose of this medication to help with the withdrawal symptoms that these newborns could experience. So it's also a lot of training that would be involved, the implementation of the tool, the screening itself, and also making sure those moms are comfortable talking about it and they understand the process. And either they can be on the Subutex or the methadone. It's medication used in the place of the opioids that can help them cope with and adjust to and decrease the cravings. The neuroreceptors in your brain, all this stuff works hand in hand, and it sends these signals to decrease the cravings for that particular drug. So through the use of this medicine, these mothers can have a healthy pregnancy and a healthy delivery and maybe possibly decrease those withdrawal symptoms that we see in the newborns. So this particular quality improvement, like I said, we need to get it started in primary care. We also need to set up collaboration with other healthcare professionals, especially behavioral health. Psych, these moms need to get that type of screening and have that one-on-one sessions to talk with those individuals so they can, really get down to see what's going on, whether it's depression, whether it's anxiety, and then after delivery, they could have postpartum depression. So it's also good to have those individuals on the team so that they can aid and assist with these mothers after they deliver. So that it will be good transition because we know postpartum depression is real and it is out there. And these moms will already be in collaboration with behavioral health so that they can transition on. But we need to tend not, please don't be biased to these young mothers because they're, like I said, we need to educate and make sure they understand what's going on. So there is research, there's evidence-based literature out there to support the use of MAT to decrease the hospitalization and the withdrawal symptoms. So I will be providing all that literature, feedback, and references to that. I'm going over the strengths, the weaknesses, and all the barriers that we might face, going through this. But implementation into the primary care is a much needed thing. And I hope that this clinic or future clinics will adopt this particular quality improvement project. Thank you for listening, and you have a blessed day. Bye.